everybody. I feel pretty humbled to be here, and as always with MEDEX, when you have a morning session like we've had this morning, it sometimes feels difficult to kind of raise the bar to the same level of patient involvement and emotion. But I am pretty sure it's impossible to change the world on your own, that you may be inspirational, you may be innovative, you may be provocative, but I don't think there's any great leader who has managed to do something completely by themselves. So hello, my name is Damian. I am a pediatrician, but I am also a father. And when my daughter was 7 weeks old, she was admitted to hospital with query suspected meningitis. And it was during that period that I saw the best that healthcare has to offer. I saw compassion, I saw hard work, I saw diligence. I had a colleague who performed procedures on the delicate veins of Bella's hand. And I'm very grateful for that. But I also saw the worst that healthcare had to offer. I saw senior doctors not introducing themselves. I saw people not washing their hands. And I saw public displays of hierarchy with individuals wanting to assert their authority. And so I suppose there's many things that I would like to have changed about mine and Bella's experience in hospital. And I'm pretty sure that there's people in this room who would like to change healthcare as well, whether as a patient, that you have suggestions for how your treatments or the way that your approach could be changed, or as a professional, what can you do about the services that you have? Change can be somewhat of a dirty word. I have a friend who has a brilliant quote. We're all a bit fed up of change, but we're not fed up of improvement. And there's many things that we can improve. We can look at the way we deliver drugs, and we've come up with some amazing chemotherapeutic agents. We've come up with some amazing antibiotics, and we've done some brilliant things with surgical procedures. And that's all fine, but actually some of those translations, I think the literature quotes 17 years to get from your first paper to something into practice. And these are for physical things. These are for physical procedures, physical treatments, quantifiable entities. And actually, what about system change? What about cultural change? What about emotional change? And these things rely on movements. So social movements are collective actions, sometimes informal, carried out by large groups or organizations. And they either carry out, resist, or undo social change. And social movements are interesting because we often think about resources in terms of physical entities. We think about people, physical people. We think about finances, or we think about technologies. But social movements release social capital, actually the thoughts, emotions, feelings that come from a population. And in that way, they can be much more powerful. And in healthcare, because our values are often so aligned, they can produce great things. You may have heard of the IHI, the Institute for Healthcare Improvement, and they looked at the 5 Million Lives campaign. And that was a social movement about reducing medical error in hospital. And the IHA claimed that that was a hugely successful social movement which really drove change in the American healthcare sector. But social movements have been around for a while. They are nothing new. They've been going on for centuries. But something has changed about social movements recently, and that is the power of social media. And social media has shown that we can disseminate at scale, we can have impressive knowledge translation, and we can get engagement of both professionals, the public, and patients in a way that has just never been attempted or achieved before. And social media has become a means of bringing good to the common man, as it were. And I would like to talk about a few social movement, social media related initiatives that I've been involved in. NHS Change Day harnessed the collective action of a grassroots frontline movement. It started in late 2012, and the first NHS Change Day was on the 13th of March 2013. The idea behind Change Day was it allowed people to pledge to do one healthcare improvement together on the same day. And on that first NHS Change Day, we had 189,000 pledges. It was essentially the largest day of collective action that the National Health Service in the UK had ever seen. And one of the great things about NHS Change Day is we know exactly where it started. So we have the initial tweet between myself, Helen Bevan, who's sitting at the back of the room over there, and another junior doctor, and we know where ground zero was. And we can track this social movement from an idea of collective action through, and we're now on our fourth NHS Change Day. It has become a global initiative, and it is still going very strong. And what I learned most from NHS Change Day was the power of stories. My first NHS Change Day pledge was to try some medications that I prescribe to junior doctors. And I tried a particular antibiotic. And it was amazing because I've given this antibiotic out lots before, but it is immensely unpalatable. And I mean absolutely foul. It will make you feel sick. And I'd been giving this out for years, and I had absolutely no idea how disgusting it was. And so it completely transformed the way that I dealt with parents, because I now tell them how awful this medication is and the things that we can do to make it more palatable, and actually how we improve that we make sure that the children are taking a complete course. And what's brilliant about that story is not that I learned, but that it is a story in itself. And I have a video of me and my face contorting because it's so disgusting that I have shared with colleagues in my department. And so that they are part of my narrative, so that they remember when they are giving out the antibiotic, oh, there's like, Damian, do you remember his story about the antibiotic? And that narrative carries through and is able to change practice. The other pledge was I lay on a spinal board for an hour with a block around my neck to see what it's like. And it's not great. It wasn't as uncomfortable as I thought it would be, but it made me feel sick and dizzy. And it is extremely alarming to have people looking down at you. Now, I'm a grown man, and I thought it was uncomfortable. Imagine if you're 6 years old and you're brought in on one of these things. So again, it's a powerful narrative that I could share and other people could talk about. Very recently, Kate Granger, a doctor in England, she'd been diagnosed with a rare form of cancer. She passed away. She started a movement called Hello, My Name Is, and it was based on her experience of being in hospital as a patient herself, even though she was a doctor, that people didn't introduce themselves. And she found that immensely disturbing. And so she started this what is essentially a social movement about ensuring that any healthcare professional introduces themselves. And some people in the audience will be thinking, oh, well, I do that all the time. This is ridiculous. But actually, lots of people don't. And it is easy to forget to do in the heat of an extremely busy department. The hashtag Hello, My Name Is has had 1,300 million impressions over the last couple of years. And this is a campaign that has gone into health policy in the UK, started by a single individual through social media. The social movement that I am most familiar with at the moment is something called FOAM. FOAM stands for Free Open Access Medical Education. It is a movement based around clinical educators in critical care and emergency medicine who believe that education is there to be shared and it should not be locked up behind university paywalls or difficult to access sites. So we use podcasts, we use blogs, we use shared discussions to disseminate information. And the movement has become more than just the term. And it's not a physical entity, or I've written something and I put it on a website to share it. It actually brings clinicians together who have shared values about healthcare, a shared desire to make things better. And hashtag FOAMED was something that I analysed in last year's Simpler Signals competition led by MedX. And we showed that FOAMED itself acts as a community of practice. If you look at analyze the hashtag, it shows all the attributes of a true community of practice that brings people together essentially for patient benefit. And it is a very powerful way of doing business, essentially. And it's something that I believe strongly in, and I believe this hashtag and this movement will continue to grow. And what's great about it is that, again, I know the story of foam. Mike Cadogan, an Australian emergency physician, was in a pub in Ireland, and all great social movements start in a pub. And he was having a conversation with others about the means of knowledge translation. How do we get education out there? And we know foam started 2012 in a pub in Dublin. And that's where the story comes from. So we're getting some themes here about narrative storytelling and a timeline of events. Unlike many social movements, the core purpose, the raison d'etre for what you're doing, brings people together. And this is a tweet that I actually used last year in my presentation to demonstrate what the foam movement meant to people. What's quite profound about this now is that John Hines, who was a pre-hospital medic in Ireland, has sadly now passed away following a road traffic accident. But he was inspirational in his approach to education and making sure that all hospitals had the capabilities of dealing with the most sick patients if they arrive in trauma. And he has, in a way, started his own movement about empowering top quality trauma resuscitation throughout the world. And there's a couple of videos online which are extremely highly accessed and extremely compelling viewing. So we're at the beginning of a new age of social movements driven by social media, I feel. The most recent example is a colleague in Birmingham. Dr. Adrian Plunkett is a pediatric intensive care clinician who has started a movement called Learning from Excellence. You will all have serious untoward incidents in your hospital. There will be mistakes, there will be harm, but you have to analyze those. I'm not saying don't. I'm not saying don't look at the problems that were caused, but learning from excellence is about saying, okay, when something amazing happens in your institution, how do you capture that? And how do you spread the learning from brilliance, essentially? And that is a movement that is just starting again, just based on a website, based on one individual's experience of healthcare. And so I think there are great things that are happening, and we can use social media to inspire the public, inspire professionals, inspire patients. And what I have learned is that we need to do two things. We all need to become storytellers. Now, you don't need to be a storyteller of the quality that we saw this morning on a main stage, but you need to have a narrative that is personal to you, that you can tell and that you can stand up and you can talk about. And then when we tell those narratives and we tell those stories, we can engage others in communities. And there's no better way than using social media to bring those communities together. So I say again, I think it's impossible to change the world on your own. But I think through social movements derived through social media, we can bring and deliver a connected community for the benefit of all. Thank you very much.
Much. We have time for a couple questions. Anyone have a question or a comment or thought? Yeah, go ahead. Hang on. Wait.
Hi, I'm James. I'm not a physician. I'm a healthcare designer. I'm really interested in the antibiotic story and when you took the antibiotics. Like, how does that even work, like, ethically? Is it, like, when you give it to your junior doctors, was it just like, take these, see how this is going to feel? I assume they had to volunteer, and it wasn't like an actual prescription.
Well, so they don't have to do anything at all. They don't have to try the antibiotics. All they need to know is that I've got a story of me doing it, and that there's a video that I'm quite happy to share of 3 doctors actually taking this antibiotic. You don't need to take it yourself, because you can watch the video and you can see our faces about how unpalatable it is. So I don't need anyone else to take any more antibiotic. I thoroughly recommend you don't, because it's really bad, but there are some children who do need this. And one of the big problems is that I've not been able to persuade anyone else so far to invest the time and the money to change the taste. Unfortunately, it's a very old antibiotic. It's completely off license. There's no pharmaceutical company really interested in making it taste better, because there's absolutely no profit to be derived from it at all. Now, there are some things that I'm beginning to learn about the ways that what you can add this antibiotic to do to make it less kind of obvious. You can mix it with some agents. The important thing is that just actually, if you know it tastes bad, it makes it easier for parents to work around something. But if you don't tell a parent that this antibiotic tastes bad, they will struggle with their child, because the first time they will just give it unprepared, the child will take a big spoonful, absolutely hate it, and then it's game over. They're never going to take it again. So it's just that preparation. The ethical question, though, is I got permission from our senior pharmacist, and on the video, I'm very clear at the beginning that we had permission to taste this antibiotic ourselves, and we weren't just kind of pulling stuff off the shelves and having a bit of a go.
Talked about how social media leverages this narrative, and you get a big reach and it's community practice. That let you get your story about the antibiotic out. What are the potential pitfalls of the ease in which a narrative can be spread? What if you have to combat a competing narrative where patients go, maybe don't take this antibiotic, it will make your fingers fall off?
Yeah. Okay, so what a fantastic question. So I think the most obvious example of that is vaccines. So if you look at vaccine use, the anti-vax lobby, as it were, have some very powerful tools in which to discuss with families about some of the disadvantages of vaccines. And I think there is no easy answer. My personal belief is that the risks outweigh the benefits, and it is up to us to create stronger, more telling narratives that involve patients. And one of the things I don't see happening enough now, this is true, I think, of the foam community, I think it's very true of many healthcare-centered social movements, is that we've not got the public, the patients, and professionals together at the same time. And I think that's something that's missing, is that MedX, I think, is very good at doing this in a conference setting, but what we really need is some resources of patients and public and the professionals there together at the same time, delivering cohesive narratives.
Okay, thank you so much. Our next speaker is Robbie.